There's a hidden truth that most seniors will never hear from their doctors. Every year, millions line up for routine health checkups, convinced that every scan, test, and screening is a ticket to a longer life. But what if some of these tests, the ones you've been told are essential after 70, could actually do more harm than good? Take Mr. Johnson, 72. He faithfully went for his PSA test, colonoscopy, and even a carotid ultrasound his neighbor recommended. Weeks later, he was overwhelmed with unnecessary procedures, anxiety-filled follow-ups, and a surgery he might never have needed. His life didn't get safer, it got complicated. This isn't just one story. Studies reveal that routine screenings in older adults often lead to overdiagnosis, false positives, and treatments that carry real risks. Infections, bleeding, heart complications, even strokes, and the worst part. Most seniors never hear about these risks because more testing is presented as always better care. By the end of this video, you'll know which 5 tests you should seriously reconsider after 70, not because they're inherently bad, but because the risks can outweigh the benefits. You'll also learn how to protect your health without endless, unnecessary tests or stress. This isn't about skipping care, it's about making smart choices. After 70, your health decisions should empower you, not trap you in cycles of worry, procedures, and complications. Test number 1, routine PSA screening men over 70. Let's start with a test that men over 70 hear about constantly, the PSA or prostate-specific antigen screening. On the surface, it seems simple, a quick blood test that could detect prostate cancer early. But here's the hidden truth most seniors never hear. After 70, routine PSA screening may do more harm than good. Prostate cancer is often slow-growing. In many men over 70, it would never cause symptoms or shorten life. Yet when PSA levels are elevated, doctors usually recommend follow-up biopsies, imaging, or even surgery. And these procedures carry real risks. Bleeding, infection, urinary problems, and sexual dysfunction are common. Take Mr. Thompson, 72. He went in for a routine PSA test simply because it's what men do. His levels were slightly high. Within weeks, he had a biopsy that led to a severe infection, putting him in the hospital for days. The cancer, as it turned out, was so slow-growing it might never have caused him any problems. What many seniors don't realize is that PSA testing is prone to false positives. A slightly elevated PSA doesn't always indicate cancer, yet it triggers a cascade of worry, more tests, and sometimes unnecessary interventions. That anxiety alone can take a real toll: sleepless nights, loss of appetite, and emotional stress that affects family and daily life. Studies show that most men over 70 are more likely to suffer side effects from treatment than to benefit from early detection. Major guidelines now recommend stopping routine PSA screenings for men above 70 unless there are specific high-risk factors or symptoms. It's not about ignoring prostate health, it's about making informed decisions. Men over 70 should discuss overall health, life expectancy, and personal priorities with their doctor before deciding on PSA testing. In many cases, careful monitoring, healthy diet, exercise, and heart health may be far more valuable than routine screening. Choosing wisely can save not only your health but also your peace of mind. Test number 2, routine colorectal cancer screening. Average risk adults beyond 75. Colorectal cancer screening has long been promoted as a life-saving measure. Colonoscopies, stool tests, and other methods are designed to detect cancer early, ideally before it becomes dangerous. For many adults, these tests are effective and appropriate. But after age 75, for those at average risk, routine colorectal cancer screening can quietly shift from helpful to harmful. Here's the reality most seniors never hear. As we age, the risks of the procedure begin to outweigh the benefits. Colonoscopies, while common, are not without danger. Bowel perforation, internal bleeding, adverse reactions to anesthesia, infections, and even emergency hospitalization are all known complications, particularly for older adults managing multiple health conditions or taking medications like blood thinners. Take Miss Jenkins, 77, for example. She felt healthy, had no symptoms or family history of colorectal cancer, and simply followed the advice to keep up with screenings. During her routine colonoscopy, a minor perforation occurred. It led to emergency surgery, a week-long hospital stay, and a slow, painful recovery. In the end, no cancer was found, only the lasting impact of a procedure she may never have needed. Statistics reveal that for average-risk adults over 75, the chances of actually dying from colorectal cancer are quite low, especially when compared to the risks of complications from the screening process itself. That's why respected health organizations, including the U.S. Preventive Services Task Force, now recommend stopping routine colorectal screenings in older adults. especially if their life expectancy is limited or they have other serious health conditions. Another hidden truth: colonoscopies are physically and emotionally taxing. The preparation days of dietary restrictions, fasting, and consuming powerful laxatives can strain the body, disrupt sleep, and lead to dehydration or electrolyte imbalances. For frailer seniors, the stress of this preparation and the recovery process may be worse than any potential findings. Even less invasive tests, like stool samples, can trigger a cascade of further testing, often leading right back to colonoscopy. Many seniors don't realize the emotional toll either. The anxiety leading up to the procedure and the stress of recovery can erode quality of life. Mr. Henderson, 78, shared how he spent weeks obsessing over his upcoming colonoscopy, losing sleep and skipping meals. When the results came back clean, the relief was real, but he admitted the experience had drained him physically and emotionally, a heavy price for a test that might not have been necessary, instead of blindly following a rigid screening schedule. Seniors should focus on symptom awareness and preventive habits, eating a high-fiber diet, staying active, drinking enough water, and avoiding processed meats. If warning signs arise such as rectal bleeding, unexplained weight loss, persistent constipation, or abdominal pain, they should absolutely be investigated. But for those without symptoms and no strong family history, ongoing routine testing may no longer be necessary. Routine colorectal cancer screening, like many medical practices, should be re-evaluated in later life. What once helped prolong life can, past a certain point, introduce more risk than reward. The key is personalized care, guided not by blanket recommendations, but by thoughtful conversations about age, overall health, and personal priorities. Knowing when to step back may be the most powerful decision a senior can make for their long-term well-being. Test number 3. Routine screening mammography, women over 75. For decades, mammograms have been promoted as the gold standard for early breast cancer detection. Women are told, get your mammogram every year, and it becomes a ritual, a symbol of vigilance and self-care. Yet after around age 75, routine mammography may no longer provide the life-saving benefits it once did, particularly for women who are healthy, symptom-free, and living independently. Here's the often unspoken truth: mammograms can lead to overdiagnosis. This means detecting tumors that are slow-growing or entirely non-threatening, cancers that would never have caused problems during a woman's natural lifetime. Imagine receiving a breast cancer diagnosis at 77, undergoing surgery, radiation, or chemotherapy, all for a tumor that might have remained harmless. The emotional and physical strain is profound. Consider Mrs. Lewis, 78. She felt well, exercised regularly, and had no family history of aggressive breast cancer. Her routine mammogram revealed a tiny tumor. After consulting her doctor and a second opinion, it became clear the tumor was unlikely to grow aggressively or shorten her life. Yet the weeks that followed were filled with anxiety, multiple follow-up appointments, and biopsies. She struggled with sleepless nights, worrying every time she felt a minor ache, and her quality of life temporarily declined. Medical research confirms what many clinicians are recognizing: the benefits of routine mammograms decline sharply after age 75. Meanwhile, the risks remain real: false positives, unnecessary biopsies, infections, overtreatment, and emotional distress all rise. In fact, some women undergo invasive procedures that could have been entirely avoided, experiencing complications that linger long after the tests are completed. Routine mammography at this stage of life should never be automatic. Decisions must be personalized, taking into account overall health, life expectancy, personal values, and willingness to undergo potentially taxing treatments. For many older women, a better approach is heightened breast awareness, noting any new lumps, changes in breast texture, pain, or nipple discharge, and reporting them promptly. Coupled with open conversations with healthcare providers, this approach respects both safety and dignity. In later years, the goal shifts from detecting every possible cancer to maintaining quality of life. Screening should empower, not frighten. By choosing informed, individualized care, seniors can avoid unnecessary interventions and focus on what truly matters: comfort, independence, and peace of mind. Test number 4. Screening for asymptomatic carotid artery stenosis. Carotid ultrasound. Carotid artery stenosis occurs when the arteries in your neck, which supply blood to the brain, become narrowed. The idea behind screening seems straightforward: detect blockages early, prevent strokes, and protect your brain. On paper, it's the kind of preventive measure that makes perfect sense. But for seniors who show no symptoms, routine carotid ultrasounds may carry hidden risks that are often overlooked. Here's the catch: most asymptomatic seniors with mild or moderate narrowing never experience a stroke in their lifetime. The narrowing can exist quietly, without ever affecting your daily life or health. Yet when a blockage is detected, doctors often recommend invasive procedures, carotid endarterectomy or stenting, with the intention of preventing a future stroke. These surgeries are not without danger. Complications like heart attack, stroke during the procedure, bleeding, nerve damage, and even death are real possibilities. In some cases, the cure can be worse than the disease. Take Mr. Thompson, 82, for example. He was in good spirits, active, and feeling well when his doctor suggested a carotid ultrasound just to be safe. The test revealed moderate narrowing. Despite having no symptoms, he was advised to undergo surgery. The operation went technically well, but the weeks that followed were grueling. He lost strength, needed help with daily tasks, and his independence, something he had treasured, was compromised. All of this occurred for a blockage that may never have caused him any harm. False positives are another hidden risk. Ultrasounds can overstate the severity of narrowing, triggering unnecessary anxiety and leading to interventions that carry far more risk than benefit. The emotional toll on seniors is often underestimated. The stress of hearing about a blocked artery, the repeated doctor visits, imaging tests, and the looming possibility of surgery can disturb sleep, appetite, and overall mental health. Current medical guidelines now strongly advise against routine carotid screening in asymptomatic seniors, particularly those over 70. The real focus should be on controlling modifiable risk factors: blood pressure, cholesterol, blood sugar, and lifestyle habits like regular exercise, a healthy diet, and quitting smoking. These steps reduce the likelihood of stroke naturally and safely, without putting your body through potentially harmful procedures. Ultimately, carotid ultrasounds demonstrate a broader lesson about preventive care. More testing is not always better. A test that seems like it will protect your health can, if used indiscriminately, become a source of unnecessary harm, both physically and emotionally. For seniors, the wisest path is informed decision-making, thoughtful discussion with your doctor, and prioritizing strategies that truly preserve health and quality of life. Test number 5. Routine resting or exercise ECG screening in asymptomatic, low-risk adults. Electrocardiograms, or ECGs, are some of the most common and trusted tools in medicine. They monitor your heart's electrical activity and can be life-saving when symptoms such as chest pain, palpitations, or shortness of breath appear. On the surface, it seems logical that regular ECGs might catch hidden heart problems early, but here's the hidden truth for seniors over 70. If you're asymptomatic and considered low risk, routine resting or exercise ECGs can actually cause more harm than good. The problem is false positives. Picture this scenario. You arrive at your annual checkup feeling energetic, walking briskly, no chest discomfort, no dizziness, completely fine. Your doctor performs a routine ECG and it shows a minor irregularity. Suddenly, a cascade begins. Follow-up tests are ordered: stress tests, cardiac imaging, and in some cases, invasive procedures like coronary angiography. Each of these carries tangible risks: radiation exposure, allergic reactions to contrast dye, bleeding, or even heart complications. And that's not counting the emotional toll: anxiety, sleepless nights, constant worry, and the disruption of daily life. Research consistently demonstrates that routine ECG screening in asymptomatic seniors rarely uncovers serious conditions early enough to improve outcomes. Leading cardiology organizations now recommend avoiding these screenings unless there are clear symptoms or substantial risk factors, such as a history of heart disease, high blood pressure, diabetes, or family history of sudden cardiac events. Consider Mrs. Evans, 78, who went for her routine checkup feeling perfectly healthy. Her ECG suggested a potential heart problem. In the following weeks, she underwent multiple scans, a minor procedure, and endless hours in waiting rooms. Physically, she recovered, but emotionally she was exhausted, anxious, stressed, and less independent. The ordeal added little to her long-term health but took a heavy toll on her quality of life. The lesson is clear: genuine heart protection comes from lifestyle choices, not automatically scheduled tests. Balanced nutrition, regular physical activity suited to your abilities, maintaining healthy blood pressure and cholesterol, and avoiding smoking or excess alcohol all have a far more meaningful impact on longevity and cardiovascular health. Routine ECGs show how well-intentioned preventive medicine can backfire. They can trigger unnecessary procedures, stress, and complications without providing real benefit. The key for seniors is personalized care, understanding your risk, listening to your body, and only pursuing tests that truly matter. Prevention is most powerful when it's deliberate, not automatic. Now that you've seen the full picture, it is time to face a truth most seniors never hear. More testing doesn't always mean better health. Those routine checkups you dutifully line up for each year, Some of them might be quietly doing more harm than good. From PSA screenings to resting ECGs, the risks of overdiagnosis, unnecessary procedures, and the anxiety they bring can quietly chip away at your quality of life. But here's the empowering part: knowledge is your best defense. You can take control of your health without blindly following every routine test your doctor lists. The key is understanding your personal risk, your symptoms, and your priorities, and discussing them openly with a trusted physician who respects your individual situation. Think of it this way: your life, your health, and your time are precious. Instead of spending them in waiting rooms, unnecessary procedures, or dealing with the fallout of false positives, focus on the things that truly matter: nourishing your body, staying active, managing chronic conditions wisely, and enjoying your life fully. Here's a practical approach to remember: ask questions before every test. Do I really need this at my age? Understand the risks and benefits, not just the statistics your doctor cites. Prioritize symptom-driven care over routine screening for asymptomatic tests. Adopt healthy lifestyle choices that prevent disease naturally. By making these choices, you reclaim control over your health and avoid the hidden harms of unnecessary testing. You can live well, stay independent, and truly enjoy your years beyond 70 without being trapped in a cycle of endless checkups that offer little real benefit. So today, take a moment to review your next scheduled tests. Ask the hard questions. Protect your health intelligently. And remember, prevention doesn't always mean testing. Sometimes it means living smart, staying active, and making informed decisions. You deserve peace of mind, not unnecessary worry. Make your health about quality, not quantity, and you'll experience the freedom that comes from truly knowing what's right for your body.